You're listening to Aging Uncensored.
Welcome back. We're so glad to have you back. Welcome back to Aging Uncensored, where we dive deep into all things aging, and it's completely uncensored. So today, I'm Chaley Lawson, the host today, and Andrew Parrish joins me again as a co-host for our part 2 of our kind of pharmacy deep dive here. Andrew is a pharmacist at Homewood Pharmacy. If you didn't listen to part 1, go back and listen. Has a wealth of knowledge and was a great conversation.
I enjoyed it.
So we want to do part 2, and I want to kind of change gears a little bit here and talk more about kind of medication packaging solutions, organizing, delivery, that whole world. I think a lot of people don't know that, especially your local kind of independently owned pharmacies, oftentimes it is an option to have your medications packaged in some sort of organized manner, which can vary, but is really great, especially when you've got a patient with cognitive impairment, you've got family managing medications, you've got caregivers administering medications. It's an awesome option. So talk to us a little bit about that.
Yes. So medications only work if we take them, right? And so
true.
the idea behind it is how can we help you in that? Because especially the more medications you get, it's just hard to manage. Like, what time of day do I take this? So many different things. It gets complicated. And oftentimes we see caregivers that are trying to manage that as well.
Yeah.
And so they'll have the little pill planner and they'll go to mom or dad and pack it up during the week. And that's wonderful. There is opportunity there for errors in packaging and different things can happen with that. So yeah, what we offer is a strip packaging system. And so the idea behind it is it just comes in a roll in a box, and then you can just pull it directly out of the box, and it'll have the date, it'll have the time of day, and the list of the medications that are in each pouch. And so you simply just tear it off, open it up, and take it at that time of day. Yeah. And so we found that to be very helpful for patients as well as caregivers.
Sure.
I can't tell you how many caregivers have just thanked me for the burden that's taken off of them. Yeah. Because that's very difficult to do that and care for your family member in that way. So we really, really try to make it simple. Another thing that I love about doing the packaging is we talked about in part 1 of reviewing all of your medications, and that's a part of that process.
Yep.
And so before you package with us or really anywhere, we need a correct and accurate med list. And as a part of that process, we're often going to be reconciling different things. We're going to be reviewing to make sure that there's not a high risk drug that we can consider having a conversation about. There's not drug interactions. All those things are a part of the packaging process. And so it's a great opportunity to do that and the packaging all in one. And so I think it's a very helpful tool. And honestly, if I took more than a few meds, I would probably do it for myself,
Absolutely. I have used it, oh my gosh, so many times. I've used it when there's compliance issues. I've used it when there's just like the patient or caregiver just can't quite navigate all the pill bottles. It's really difficult. I've used it when there are patients who have cognitive impairment who still are self-managing medications, but there's certainly concerns that they shouldn't be, but they're maybe paranoid or concerned about having a daughter do it, or, just the underlying disease process may complicate that. And I've said, you know what? Let's not have your daughter do it. I agree. She shouldn't do it. Let's have a pharmacist do it. And they love that. Yeah. And so I've used that before. It has been life-changing for patients I've had.
It has.
In fact, I will say when I've seen a new patient and it's been obvious that they're not compliant with their medications, it's obvious to me. I look at the pill bottles. the pill bottles are all full and they're all a year old. And the provider that they've been seeing has just been titrating things up and up and up. And so they've got 3 doses of hydralazine, 2 doses of carvedilol, a variety of other things, God only knows what. They've got a pill bottle with some pills that I don't know what they are.
No. Mixed together.
I've
gotten pill bottles before, and it's literally like 10 different drugs just all put together. And then also, like, something will be labeled, and I'll have like 20 of one and like 5 of another.
Yeah.
It's not the same drug. It's not that it's a different manufacturer or something. It's just completely different.
Yeah.
And then so many, like, well, a lot of times as part of the process, we'll pick up old meds. Yeah. Just so to get them out of the house, get them out of reach.
Yes.
Just to kind of simplify the process. And I can't tell you the number of times I just get like a huge sack full.
Yeah.
And I'm like, I have medication for a year.
Yeah.
How did we get here?
And this is not judgmental. This is just like the reality of it. It's the reality of our healthcare system.
Yeah.
It's a representation of how fragmented and complex it is, and how it's like a tangible representation of how we cannot manage each individual piece of this. And we need help.
And we recognize that it's hard, like, especially the more medications you get, it's hard to keep track of that. And in some ways, I mean, that's a huge mental load on you if you're doing your, like,
that's right.
Oftentimes, even with people that are in my family and people I know, it's like, I can't remember if I took my medication this morning. You know, should I take another? Should I wait? Like, we all get busy.
Right.
And
that's right.
There's things. And so the beauty of the packaging is you can look.
That's right.
Or you can say, oh, well, this morning's is torn off and it's no longer here. So yes, I did take it this morning. I don't need to worry. Or no, I didn't. And I need to have a conversation with my pharmacist or my provider about what to do.
Yep.
So even from that standpoint, it's very helpful for patients.
I know as a provider, what I've had to do is when I see a patient who I think is not taking anything, or I'm not sure what the heck they're taking, and I've got them set up with pill packs, I've had to use some kind of clinical judgment on like what I start, because if say a patient's on 5 antihypertensives, well, they hadn't really been taking them. People have just been adding them because they weren't taking anything. Like, you've really got to think about that. Like, you don't want to put all 5 of those necessarily in the pack and then they get hypotensive. Like, you have to really, like, as a clinician, if I'm starting a patient on pill packs that's been non-compliant, I really have to keep a close eye on them. Make sure they're not getting hypotensive, their blood pressure's not getting too low, their blood sugar's not getting too low. Like, have to be careful.
No, I love that. And in some ways you have to be a detective.
Yeah, that's right.
And so you're kind of counting pills, and then you're calling different providers and just looking at what's in front of you and making the best educated decision that you can make.
Yep.
And you want to be cautious, right?
Yeah.
You just want to put like you said, and have a negative outcome due to pill packaging. So we can always add over time if needed. So say you're in this kind of position where you've got some medications that are being adjusted. Like, you're not on your provider, you're working with a provider to get some things under control. Like, when is a good point in that? Like, when you can start using pill packs? Like, do you really need to wait until your medicines are stabilized? Like, how do we, like, I know you can't repackage everything every day. So like, what's the recommendation? Not necessarily. I mean, in some way that would be the ideal world, right?
Sure.
All this is stable. Like, you've been on it, here, package it.
Right.
And we recognize that that's not always the case. And so sometimes we'll just pack a week worth of medication for a patient. Occasionally, and we don't like to do this, but occasionally you'll have a bottle with it and say, listen, talk to your provider, and depending on this or that, take it or not. We can also offer like individual blister packed medications.
Oh, yeah.
We've done that sometimes before, and we'll actually write the date on there. So that's a way to kind of get it out of a bottle, and then you can visually look and see whether it's been punched out or not. So sometimes we use that, but we recognize that one of the hesitancies to some starting pill packaging is like, what if my doctor changes the medication?
Right.
What if this? What if that? At this point, we've we haven't seen it all, but it feels like we've seen it all.
You probably have.
And it's just like nothing's going to surprise us.
Right.
There's nothing new that's going to come up and be like, oh, I don't know how to deal with this.
That's right.
And so in extreme cases, we'll come and pick up the medication pack and repackage it. Or there's a lot of different ways that we can do to work with that. Sometimes we'll send a short supply of something that really must be started. So we can send a short supply in a bottle or a short supply and like a little blister card. There's different ways that we can work. And it's also going to be patient dependent as well.
Sure.
Because some of our patients that are on the packaging are very much with it and know exactly what they're taking when, and others less so. And so part of that's knowing the patient individually and having a conversation with the provider. Thankfully, the what you established with UAB house calls and what they continue to do is when the new prescription comes over, a lot of times we'll get a note and it says, okay, to start in next pill pack.
Right.
Or please send short supply, or please repack. And so that helps us know, okay, how urgent is this? Because
that's right.
Sometimes it can wait, a week, and then you can start and go from there. And other times you're like, we really need to get started as soon as possible.
Right.
And so we work closely with providers with that to make sure that we're doing what's best for the patient.
That's awesome. Yeah. And I know as a provider, like I'm always mindful anytime I'm doing anything with someone's meds, like how are they receiving them? Are they in a pill pack? Is a family member putting them in a planner? Like, what are we doing? Because that's part of the process of like planning. Like you need to, can this wait till their next pill pack, which is due next week?
Sure.
Does it have to be done today? All of those things to consider.
But we are not scared of that in the least.
Okay.
And so
good to know.
My encouragement is that if you're considering this and you're concerned about that, don't be. Like we're going to work with you. We're going to work with your provider to make sure that you're taken care of. And like I said, we've seen most every scenario, and so we can be adaptable and make sure that you have what you need when you need it.
I love that, and I so appreciate that. I think that is a true reflection of your attitude at Homewood Pharmacy. So
we do love our patients.
So I know, like, if you're not in, so tell me this. Tell me, some people have scheduled medications, and then they may have PRN or as needed medications in addition. So do y'all typically put that in a pill bottle and just have them take it in addition to their packs? Yes,
patient specific.
Okay.
So sometimes it is a pill bottle. If it's like a pain medication or like an allergy medication they may not take every day, it can be in a pill bottle. Other times it's in that single blister packaging.
Yeah.
And so it's patient specific.
Okay.
But yeah, we get everything synchronized together so that in an ideal world, we're filling everything one day out of the month.
Sure.
And you're getting all of your meds, one pickup or one delivery or one shipment, whatever we're doing for you.
Perfect. And so you all deliver.
We do.
Right? So
yes,
tell me so you're in Edgewood, in Homewood, Alabama. Tell me what the delivery range is.
It's a broad delivery range, especially for our packaging patients. Like we have patients that live in Moody.
Okay.
We have patients that live like Inverness down 280. We have patients that live more like the Hoover side, like towards McCalla area. So it's really a wide span there.
Yeah.
If you're not one of our packaging patients, we're probably not going to deliver something 4 times a week that far away. But the idea is that once we get everything synchronized together, we can have that on our calendar.
Perfect.
And deliver it.
And be able to plan for it.
So yeah, we really try to take care of our patients from that standpoint.
Yeah.
We know that transportation can often be difficult.
Really challenging.
And so we do everything we can to help with that, to make sure you have what you need. And so yeah, it's a broad range.
That's beautiful. I mean, I know, like, I've had medications that have sat at the pharmacy for a couple of days when I haven't made it there. And like, you have texted me, or like Mason's texted me and been like, do you want me to deliver this for you? And I'm like, oh gosh, no, I'll come get it. You don't have to do that.
Yeah, we care. We want to make sure, like I said, if you don't have your medication, you can't take it.
That's right.
So we want to make sure you have what you need.
That's right. So if someone doesn't live within that area, what would you recommend? Like, are there other independent pharmacies in Alabama that are doing this as well? Can they have it mailed through
you? Yeah. So in the state of Alabama, we can mail it. If if you, like, say you're working with us and you want to stay with us when you move somewhere in Alabama, we can certainly accommodate that. Also, we'll work with you to help find a pharmacy because, and I understand this, like wanting a pharmacy in your hometown or where you live is really important.
Right.
So that pharmacist and patient relationship is key.
Yep.
And I would say if you don't know your pharmacist's name, then get to know your pharmacist.
Yeah.
And if that's not a situation where that's possible, then maybe consider using a different pharmacy. I think having that relationship is really important.
Yeah.
With your pharmacist. So if you were to move somewhere, we would work with you. So we would try to find another pharmacy in the area that does something similar, and we can recommend them to you. But if not, we're happy to mail as well.
That's perfect. That's awesome. And then I know cost is always a concern.
Yeah.
So tell me about like the cost to the patient for this.
This is a beautiful thing. It's no charge, no charge to the patient. So it's we do that as a service to you, in hopes that your outcomes are better, and you're able to take your medication appropriately. And so that is a big question because we know that cost is an important factor in medication compliance. And so we don't charge for delivery and we don't charge for packaging.
That's awesome. Now, I don't know a whole lot about these kinds of things, but like I know I've had patients in the past that have had sort of like a variety of automated pill dispensers. Do you know anything about any of those?
I've heard of them and we've had a few patients use them, but it's not something that we work with very much.
Yeah.
I know they exist. I think the hard thing with those is that someone has to load them.
Someone's got to load it. That's
and
right.
so that's going to be a burden on either the patient or the caregiver.
Yeah.
And the systems are going to continue to get better.
Yeah.
And so really our whole heart in this is that we just want you to take your medication.
Yeah.
How you're supposed to take it, when you're supposed to take it. We believe we have great solutions to help with that. But if you find that an automated system works for you and your family and you're taking your medication and you're having great outcomes, by all means use that.
Yeah.
But I think there's, again, costs associated with those. Those aren't going to be cheap.
Right.
And so that's something you have to consider. But I would say, however you can go about taking your medications appropriately, like we're a fan of that. Like we're not going to be possessive in that way.
Absolutely. And I love it from a provider standpoint because when a patient is taking pill packs, I know what they're taking. If I get there and the dates are off.
Yep. Something's wrong.
Something's wrong.
Right.
Like, I'm like, it's, March 12th today, but you're on December 2024 pill packs.
Right.
Like, what's up, dude?
It's a big problem.
We had an issue.
And we always call patients before, but not all, but a vast majority of our packaging patients are delivery patients.
Mm-hmm.
And so we'll call and have a conversation before to check, say, hey, any changes? How are things going? And at that time, sometimes they'll tell us, oh, I have a week of medicine left.
Yeah.
You're like, oh, okay. Well, we know you're supposed to run out in 2 days.
Yeah.
And so then that's an opportunity for a conversation of what's going on? Like what's the sticking point essentially to not remembering?
Were you in the hospital?
Right.
Or, sometimes
that's
things
a big one
like
as well.
that are not in their control.
Absolutely. And it goes back to what we mentioned previously about just being honest.
Yeah.
Like if you're not taking your medication, tell us. Some cases it's as simple as, I don't know why I'm taking this, or I'm afraid of this side effect.
Yeah, sure.
Or whatever reason. It can be things that we can help resolve, so that you can take your medications appropriately.
That so I don't know why I'm taking this, or I'm afraid of a side effect. Mm-hmm. Like the worst thing as a provider is when you prescribe something and they call and they say, I read the package insert. I read it.
Yeah.
And there is no way I'm taking that thing.
Right.
Are you trying to kill me? Did you see what it can do?
Yeah.
Just makes me think of that.
Mm-hmm. The package list insert has to list every potential possible thing, right?
Right.
And we've had those conversations with patients before.
I mean, I get it. I'm glad that people are reading the information that's being given to them. I think you just have to be open-minded, have a conversation with your provider, understand that when a medication is being prescribed, it's a whole thought process.
Yes,
there are 5 million things to think about. It's always risk versus benefit. And so just be open-minded.
Yeah, and be honest as well. Like if you're experiencing something on a new medication, like let us know. It could be something that's expected and it might go away, or it could be more concerning and it needs to be escalated. So
that's right.
Be aware of what's going on and definitely let us know.
Yeah, absolutely. Another big thing is like when I think about, like we've been talking about reconciling medications and like compliance and everything, is changes like when patients come out of the hospital, or my personal favorite is hospital rehab home. So we've got med changes made in the hospital that may or may have not gotten communicated to rehab, and then we get home and we're like trying to sort through all of that. And it's a mess oftentimes.
It is a mess. And so that goes back to detective skills.
Yep.
And so we're calling the hospital, we're calling the rehab.
Yep.
And then we're looping in primary care, whoever their primary provider is, and say, hey, like, this is what was changed. This might be the reasons it was changed.
Yep.
Do you agree with this? Do you want to continue? And the best case scenario is that the patient is seen quickly.
Yeah.
By a provider.
Right.
To have that opportunity to have that conversation.
Yep.
But we see, a lot of times a hospital or a rehab facility will have certain formularies. So they might have a different blood pressure medicine that's not exactly the same, but they have to use that one. So that could be a reason that something's changed.
That's a really good
just
point.
Because that's their formulary.
That's a great point.
Once they get back out in the community, we may not continue that change. That was just a temporary thing while they were hospitalized or in rehab. But that happens.
That makes total
often.
sense. I hadn't even really thought about that. It's funny because my daughter takes a medication every day, and recently the color of it changed, which I know. I mean, she was like, "Mom, I don't think this is my medicine."
Always, we get those phone calls, and I welcome those.
Yeah.
Right.
Yeah.
I always, if there's any doubt in your mind, like, just ask.
Yeah.
And we have our records, and we can say, yes, the manufacturer changed. It looks like red and green now instead of blue and yellow. And that's comforting, right? To know that, because it can be, if you're used to seeing something and all of a sudden it's different, like, ask.
Yeah, absolutely.
I'd rather you ask.
Absolutely. And I'm skipping around a little bit here, but like back to when you have pill packs and like when you have a change, when you come home from the hospital, like when a provider can see your pill pack and that's a really good starting point.
It is. And
sometimes when we just have random pill bottles, we don't have a good starting point. So like that can create so much consistency and much and less error, and like it just is like, it's like a golden nugget when you've got a solid
that would be a dream for a hospital physician or a rehab doctor, right?
Yeah.
If you're able to bring in that box.
Yeah.
Like, this is what I'm taking, right? And they know at that point.
That's
and then
right.
they can make decisions or adjustments as needed from there. Because med history it's not always, but generally a challenge.
It's like a science. Like,
it is.
It's something you get better with over time. I think, like, in my experience, like teaching students how to do it, like, it's nuanced. Like, there's so many variables. There's so many things to consider. Like, it is not just comparing a list.
No, it's not.
You have
to get in the nitty gritty and actually see what's going on. And so, so I like to actually put my hands on bottles or pill packs or whatever.
That's
and then that gives you a better history of what's going on.
Yeah.
And to be fair to patients, like, it's confusing, especially when there's so many pill bottles.
Sure.
Especially if you're sick and you've been hospitalized or in rehab, like,
gosh,
your brain's foggy. You don't, it's okay. Just be honest. Be like, I don't know, but here's my meds. Please make something of this.
That is right. We don't expect you to know.
No.
You're not supposed to know. It's
We've had a lot of training in this.
That's right.
We see it all day, every day.
That's right. We were not born knowing this stuff. It's funny because, like, when I'm reconciling meds, or even if I have to do it over the phone sometimes, and people struggle, they're like, I don't know how to pronounce this.
It's okay. Do your best.
Do not worry. It is fine. We will not judge you.
Absolutely.
Like, just spell it slowly or something, whatever.
Yes.
So.
And most of the time, at least from my perspective, like, if you get it close, like, I'm going to know, right? I'm going to know what it is. So don't have any shame in that.
No, this is the no shame game.
There's
no room for shame.
That's right.
So, all right. Well, that was amazing. I really appreciate your time today.
Yeah, absolutely. I hope that was helpful. And if anyone in the Birmingham area could benefit from this service, please let us know.
Yep.
That's not the purpose of me coming on here, but I do believe that we can be very helpful.
Absolutely.
In this area.
Absolutely. 205-871-9000.
That's right. That's right. You got it. You got it on lock.
I know their phone number.
Got it on lock.
So,
yes. Please call us. We'd love to take care of you.
Yeah. And if Homewood is not in your area, Homewood Pharmacy is not, like, find yourself. We have an abundance of independently owned pharmacies in this area that provide excellent services.
Absolutely.
I highly recommend them. Get to know them, use them. If your pharmacist is not for you, they're against you. So find one that's for you.
Absolutely. Very important.
Yeah. All right. Well, thank you all so much for joining us today. Be sure to like, share, subscribe, tell a friend, and we can't wait to see you next time.